Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a disorder called obsessive compulsive disorder. Before I go and dive into the Mental Health America test, what I wanted to do is kind of describe what OCD represents. So, how this works is there are obsessive thoughts, which are called intrusive thoughts, and then compulsions or something called repetitive behaviors. So, some of the areas and or obsessions that are especially important to note are and this leads to anxiety as well, and significant anxiety over time. But the obsessive thoughts include contamination, like fear of germs, and the people I know, they wash their hands many different times, maybe even 50, 60 times, or check the door multiple times when going out. So these are things that are especially characteristic of OCD. There's also doubt and harm. So if there's worry about a mistake, forgetting to lock a door, like I said, or accidentally causing harm to yourself or others. Um, Also, symmetry and order need to have objects perfectly aligned, balanced, or facing a certain way. And then forbidden and taboo thoughts. So, intrusive, unwanted thoughts or mental images concerning violence, sex, or religion. So, these are the types that are obtrusive or obsessions, intrusive thoughts. And then there's compulsive thoughts, four of which are washing and cleaning, checking, ordering and arranging. That's that aligning thing, but in a different format, and then counting and repeating. So, counting items or repeating words, phrases, actions multiple times until it feels just right. So, these are all mental illness. All are is all con, is considered like um, are a continuum. So, many different forms of OCD might appear in terms of continuum. So, OCD test, what are some of the questions that are asked in the test? Well, first of all, this is in the past 3 months, and I'm not going to go over the symptoms again, but here are some sample questions that are in here. And Mental Health America, again, does a very good job of classifying some of these conditions. So, have you had to count things over and over again or make yourself do things a certain number of times? Was there a time when you washed your hands or body over and over again or changed your clothes many times each day because you thought they were dirty? Have you often felt you should check on things over and over again? The stove is turned off, the door is locked, or something else was done, even though you knew it has been done. And then, of course, things you touch are dirty or have germs. Nowadays, of course, that is something that is a worry after some of the pandemic and things like that. But um, so after so this was 3 months, and then in the past month, I have saved up so many things that they get in my way. Um, I check things more often than necessary. So I'm not going to go over all of these symptoms, but there's about 18 questions, which is in the last month, and then about 4, 5 questions in the last 3 months. So when you're taking these tests and whatnot, you want to make sure the time span is accurate. So like in depression, the questions that are answered are in the last 2 weeks. However, when it comes to diagnosing obsessive compulsive disorder, these are in the past month, um, or 3 months. So knowing that order, knowing that time span is just as important as answering those questions. And a lot of times when you do go to the physician or mental health professional, they ask you to answer some of these questions because that's the only way they know how to treat your conditions. So, in a nutshell, here's the questionnaire for OCD. Understanding the symptoms, that's oftentimes important. And knowing that when to go to a mental health professional is especially important. I hope this has made some sense. Thank you for listening.